first of all, what is it? That'd be very important for you all to know before I get started. So it's when there's recurrent inflammation of the connective tissue. As you can see here, this is like the connective tissue in your joints. It's when the immune system mistakenly attacks your own body's tissues. So here's a little video. This explains it, like pretty much what it is a little bit better than I can, so hopefully you can hear it.
Painful and swollen joints, deformity in the hands.
Deforming arthritis is one of the signs of rheumatoid arthritis.
Dr. Eric Madison is a rheumatologist at Mayo Clinic. He says rheumatoid arthritis is quite different from the more common osteoarthritis.
It's an autoimmune disease, which means that the immune system is overactive for some reason that we don't know and decides to attack the lining of the joints, causing inflammation in the lining, which leads to damage in the joint structures, the cartilage, the bone.
There are medications to help slow the disease and offer pain relief, but not a way to prevent it. Dr. Madison says early treatment is important.
Rheumatoid arthritis untreated leads to severe joint damage. It actually shortens life expectancy.
For the Mayo Clinic News Network, I'm Vivian Williams.
Okay, so like I said in the video, there's obviously a big difference between rheumatoid arthritis and osteoarthritis, and it's important to understand those differences so that we don't get them confused. So rheumatoid arthritis, it's an autoimmune disease in which the body's own immune system attacks the body's joints, whereas in osteoarthritis, it's caused by mechanical wear and tear on the body's joints. So overusage, or like a lot of times when you get older and you've been using your joints for quite some time. Rheumatoid arthritis, the joints are painful, stiff, and swollen, whereas in osteoarthritis, they may be tender, but there's not as much swelling, so that's like big differences there. Rheumatoid, there's also fatigue and feeling ill are present, and that's like throughout the whole body. And then in osteoarthritis, the whole body symptoms aren't present, so it just affects the joints themselves. Some other differences is that rheumatoid arthritis can start at any age, whereas osteoarthritis usually starts later in life because of the overusage and things like that. And the speed and onset of rheumatoid arthritis is pretty rapid, whereas obviously osteoarthritis, if it's caused by overusage, occurs over the years, so it's a little bit slower in onset. So what are the symptoms? Most of the symptoms occur in the joints, the back, or the muscles. So in those joints themselves, there's a lot of stiffness, swelling, weakness, or tenderness. And then there are some other symptoms that occur in the whole body, and that's things like fatigue and anemia. So most of the symptoms occur primarily at the joints, but there can be other side effects and symptoms that occur in the whole body. One of the most common symptoms is stiffness, and that occurs usually in the morning. It's the most prominent then, and usually the most painful. And then as you move throughout the day, it usually gets a little bit less painful. As the disease progresses, patients may experience deformity, so the joints start to look a little bit different, limited range of motion, and nodules, which we'll talk about a little bit more when talking about diagnosis. So assessment is really important for us as nurses because this is a lot of times our job and what we do, as well as the providers. So there's three main kinds of assessments that we're going to want to do when we're looking at patients with potential rheumatoid arthritis. The first one is a history assessment. So the first thing you're going to do is ask the patient if they've experienced any fatigue, low-grade fever, weight loss, anemia, or anorexia. So those are all common early symptoms of rheumatoid arthritis. You're also going to want to ask about stiffness. Does it occur before or after physical activity? Ask about tingling, ask if they're taking any kind of pain medications, how much, what kind, things like that. The next thing you're going to want to assess is like the physical examination part of it. So you're going to want to assess all of the joints. Look for deformities, contractors, immobility, and then inability to perform activities of daily living. So you're going to want to inspect the fingers for edema, inspect elbows for nodules, note skin lesions, and then you're going to want to have the patient do a lot of like range of motion things like flexing fingers, adduct and adduct them, squeeze their hands, so checking for strength in the joints and things like that, and then a lot of range of motion. So you're going to want to do this all over the body, in the hips, knees, ankles, elbows, hands, all those kind of things. And then the last assessment is psychosocial. So you're going to assess the patient's understanding what they think the disease is and what they think it means for them. And then you're going to want to identify their support system. What's their family like? Do they have support through what they're going through, or are they pretty much by themselves? And then ask if the pain has affected the family, work, or social life of the individual. So those are all just assessments that you have to make before obviously diagnosing. So what are some of the causes of rheumatoid arthritis? The specific cause is unknown. However, there is a lot of speculation about multiple causation, which obviously means that there's a lot of different things that play into the onset of rheumatoid arthritis in an individual. So those are just some of the things up there on the screen: infection, autoimmunity, environment, hormones, and then genetic factors. There's familial reoccurrence is small compared to that of other autoimmune diseases. However, certain genes recently have been known to be associated with rheumatoid arthritis susceptibility. Gender also plays into this, so it's 2 to 3 times more common in women than in men, and it can occur at any age, but usually peaks between ages 35 to 40, and then it increases and gets worse kind of from there. So women are at a greater risk, but for some reason they found that for the first 5 years after pregnancy, women never seem to get this. So there's pretty much like a protection blanket. After you're pregnant, women are less likely to get it. It's also more common in people with Native American ancestry compared to other people groups, for example. So those are just some of the causes. It's not just one thing. It's a lot of things kind of put together. So there are 4 main stages of osteoarthritis, as you can see here. So as I explain them, you can kind of see what I'm talking about. So stage 1 is inflammation, when the joint begins to swell up. There's a lot of stiffness and pain in this stage. The second stage, inflammation causes damage to the cartilage. So it starts to get a little bit deeper and wear away at that cartilage. There's a lot of pain and then a beginning of loss of mobility in this time. Stage 3, right here, as you can see, it starts to damage the cartilage and the bone. So again, it starts off just kind of swelling, works its way into the cartilage, and now it's getting deeper into the bone. So there's a lot of muscle weakness and immobility. The joint, as you can see, like from the outside, it begins to be a little bit more deformed, and which will obviously increase the pain. And then in stage 4, there's no longer inflammation of the joint. It's worn away at the cartilage, it's worn away at the bone. And then a lot of times in this stage, the joint no longer works, so it's pretty much immobile completely. So besides pain, what are some of the other side effects that affect the body? So there's often a lot of chest pain, so shoulder pain. There can be crackling noises and a limited range of motion. Difficulty breathing, so the inflammation that occurs in the joints can also spread into your lungs, which may make it hard to breathe. So the inflammation from the joints doesn't just stay where it is, it often like spreads into other parts of the body. Finger pain and redness, toe trouble like claw toes and bunions, those are some other side effects. Dry eyes, your eyes might feel sandy or gritty. Dry mouth, bumpy skin, things like that. Your bones may appear more prominent in your wrist, and then your wrist can even squeak a little bit sometimes. Also weakness in the knees, especially in the morning. Like I said, it swells up a lot during the night, and then it's very immobile in the morning. So diagnosis. So it can be really hard to diagnose in the early stages, mostly because the early signs of rheumatoid arthritis mimic those of other diseases. So there can be pain in the joints, but that also is associated with a lot of other diseases as well. So there's not one specific blood test or imaging test that can like determine whether or not you have rheumatoid arthritis. It's a lot of other things put together. So you often have an elevated erythrocyte sedimentation rate, which pretty much means that the body has an increased ability to inflame your joints, which obviously leads to inflammation. And then other common blood tests look at your antibodies and whether or not they can reduce inflammation. So some tests look at whether your body is at a higher risk for inflammation, and others look at whether or not your body can fight that inflammation. Imaging tests like x-rays pretty much help doctors to track the worsening of your rheumatoid arthritis. So it doesn't necessarily prove that you have it or diagnose it. It just pretty much helps the doctor understand how it's progressing, and then obviously be able to treat the patient better. So for treatment, in order to treat it, you have to know like what outcomes do we want from this. So there is no cure for rheumatoid arthritis. So a lot of times they're just treating the symptoms, relieving pain, increasing comfort, preserving joint deformity. So a lot of those things are pretty much just preventing pain. So, so what is the nurse's role in this? We obviously, as nurses, are supposed to educate and encourage our patients, so we should be encouraging exercise by teaching proper body mechanics, helping them with therapy, heating or icing joints. A lot of times surgery is done to restore joint function by removing the inflamed synovium. And then obviously, because there's no cure, medications are common because you just pretty much want to reduce the pain and increase the comfort. So prognosis, with what's likely to happen, like what's in the future for these patients. So there are a lot of outside factors that affects rheumatoid arthritis prognosis for each individual, like age, their response to the disease, activity level, and then how early it was detected. So patients can usually expect the things up above: persistent joint inflammation, joint destruction, decline in mobility and range of motion. So a lot of this doesn't improve. So it's pretty much just treating the patient, helping them be more comfortable. And then as nurses, we want to make sure that the patient understands the use of the pain relievers that they'll be on, because they'll be on them obviously probably for the rest of their lives. And then rest activity cycle, how often should they use it, how often should they not? And then also make sure that they use safety equipment if their joints are immobile. So what can you do to reduce your risk? You're gonna want to avoid foods high in sugar, salt, and fat, exercise to reduce that bone loss, and then maintain a healthy lifestyle. So that is it.